Alright, hello class. So I'm now on the fifth phase of my lecture, which is assessing the child for fever. This is part of assessing classifying the child, part 1 on caring for children aged 2 months to 5 years. Alright? So gaya po ng ginagawa natin, kapag po sinabi po ng nanay na no sa fever, we have to proceed to the next question, which is assessing for ear problem. Now if the mother says yes, we have to assess and classify the fever based on the IMCI chart. Alright? Fever is a common condition sa mga bata. One of the reasons why dinadala din po ang mga bata sa ating mga health centers. It may be caused by a minor problem, pero pwede din po itong isang obvious sign na life-threatening illness like a malaria caused by the falciparum malaria or other severe infections. Pwede din po siyang meningitis, typhoid fever, and measles. Alright, so we have the read, see, and practice test section on the right side, and we have it here on the lower left corner as well. But there, we're going to be talking about these, all four of these, as we go along with this phase. All right. So for our objectives, of course, we want to know how to assess the signs and symptoms of fever, taking into account our general danger signs. We will be classifying the child's illness according to the IMCI chart, and after completing the practice, we should have the skills to ask the mother about the symptoms, which is fever. If it's present, we're going to check for the signs related to it, and of course, classify the fever according to the signs na present sa bata. Alright, so yan, reading section po tayo. Now, we have the key steps in assessing for fever. Okay, fever may be caused by malaria, measles, dengue, hemorrhagic fever, or other severe diseases. Okay, we're going to be talking about three of these on the next sections of this lecture. Pwede rin po that the child may have a fever because of bacterial infections such as pneumonia, an ear infection, streptococcal sore throat, a dysentery, a local bacterial infection, typhoid, UTI, or urinary tract infection. Pwede rin po siyang simple cough or cold lang, or viral infection. That is the reason why it is important that we do the assessment properly and correctly. All right. It's very essential, paramount to identify the key symptoms and signs of the diseases that may cause the child's death very quickly. Okay. There are some signs of very severe diseases that may be general and non-specific. Ibig sabihin po, yung symptom na yon, hindi lang siya para doon sa sickness na yon. Okay? Hindi siya specific doon sa sakit na yon. So, pwede siyang general. So, hindi mo mapipinpoint kung ito ba ay malaria ba talaga, malaria or measles or hemorrhagic fever. Okay? Kaya lahat po ng may sakit na bata should be referred to the hospital for further assessment and treatment according to our assessment. Okay? It is important now we know how to assess because these are the two major killers of children under 5 in the world. Alright? Sa malaria risk areas naman, it's still a major cause of fever and death in the children. Matitingnan nyo po na mamaya, ipapakita ko po yung table showing malaria risk areas. Okay? So yes, sa pag-assess ng fever natin, we have the first cause or possible cause, which is of malaria. So these are caused by parasites in the blood called plasmodia. They are transmitted through the bite of anopheline mosquitoes. Apat na klase po ng plasmodia ang nagkakos ng malaria, pero ang pinaka-delikado po dito ay ang Plasmodium falciparum. Pero sa training po na ito, you will refer to the falciparum malaria causing it to the children. Okay? Plasmodium vivax is one of the most common causes, but we are going to be talking about falciparum malaria in this lesson. Okay? So, fever isa sa mga main symptoms ng malaria. Pwede ang fever present siya all the time, or it may go away and return again at regular intervals. Okay? Ang isa pang signs ng falciparum malaria are shivering, sweating, and vomiting. Okay, so vomiting, isa yan sa mga danger sign natin. If you, I discussed that on the first parts of this lecture. Okay? So, ang batang may malaria, pwede siyang magkaroon ng chronic anemia na wala namang fever as the only sign of illness. Ayan. So, ito yung tinutukoy ko na non-specific sign and symptoms. Okay? So, sa signs of malaria, um, it may overlap the other signs of other illnesses. Okay, for example, ang bata na may malaria at cough na may fast breathing is a sign of pneumonia. Okay? So, ang batang ito, kailangan niya ng treatment both for pneumonia and falciparum. Okay? Um, Although studies show that fast breathing and cough are common in children who have fever and malaria. Pero confirmed ito ng blood smear. Okay? Um, Children with malaria also have diarrhea, so kailangan din nilang anti-malarial and treatment for the diarrhea, 'di ba? So, sa isang bata, ang dami na nating na-assess, ang dami na pong sakit na um, nakuha natin because of the presenting signs and symptoms. Okay? So, in very high malaria transmission areas, ito ay isang major cause of death. Okay? Especially kapag yung uncomplicated malaria, nag-develop siya sa severe malaria in 24 hours after the fever first appears. Alright? Ang severe malaria naman may complications like cerebral malaria, severe anemia, or a general danger sign. Pwedeng maging lethargic or unconscious yung bata. Yun pala, meningitis na. That's why the assessment that we're doing here is needed for the referral of the child. Okay? Kasi ang bata may die if we don't receive the urgent treatment. All right. Next, we're going to talk about measles. So sa measles naman, yan, may fever din siya. And a generalized rash, which are the main signs. Alright? So, etong measles na to, it's highly infectious. Sa mga bata at up until about 6 months, they have the maternal antibodies to protect them. Pero after ng mga about 6 months, magdi-disappear na ito. Okay? And most cases, that's why most cases occur in children between 6 months and 2 years of age. Measles is very common sa mga overcrowded areas, poor housing, and alam po natin na this is caused by a virus. It infects the skin and the layers of the cells in the lung, the gut, the eye, the mouth, and the throat. It damages the immune system for many weeks after the onset of measles. Okay? So, yung bata naiiwan siya na at risk for other infections kasi it affects the immune system. Alright? So, sa complications naman, it occurs 30% of all cases. The most important of these are diarrhea, including dysentery and persistent diarrhea. Meron din pong pneumonia, stridor, mouth ulcers, ear infection, severe eye infection, which may lead to corneal ulceration and blindness. Okay? So, sa mga, if familiar po kayo, may mga naririnig tayo or may mga cases tayo na blind sila nung matanda na sila, blind sila kasi hindi na-treat yung measles nila nung bata sila. Okay? So yes, that is true. You're gonna be seeing videos and photos later on kung paano mo makikita itong mga mouth ulcers na to, eye infection, as part of assessing the measles sa bata. Alright? Measles also contributes to malnutrition because it causes diarrhea, high fever, and mouth ulcers. Diba? So, these interfere with feeding. Mga malnourished na bata, they are more likely to have severe complications as a result of measles. Kasi compromised na nga yung immune system ng bata, malnourished pa, magkaka-measles ka pa. Alright? Especially true sa mga children who are deficient in vitamin A. Alright? So, importante that we help the mother continue to feed her child during illness. Yan, papasok po yung health education natin dito. Alright. Now, for the third one, dengue hemorrhagic fever, or DHF. It's caused by a virus as well that is spread by Aedes mosquitoes. Like malaria, it occurs particularly in certain places and seasons. Seasonal. Yan. 'Di ba? And fever in children caused by DHF may last for 2 to 7 days. Okay? It damages the blood and blood vessels, which may lead to bleeding. Alright, kaya nga siya hemorrhagic. Alright, especially bata tong mga ito, napaka-delicate nila. Alright? It may occur in the skin, where petechiae are seen, or inside the body. And children may bleed from the mouth or nose and vomit black fluid or pass black stools, which is also called melena. And I hope that you're able to tackle that one on your assessment or in your previous other lectures, showing that the bleeding in the stomach or intestines are present. Okay? Sa ibang bata, it becomes severe na nagko-cause ito ng shock. Okay? And they die unless they receive urgent care. Alright? The most severe signs of DHF often occur in the 2 days after the fever has disappeared. We're gonna tackle that later on. The management of DHF depends on looking for signs that a child is bleeding and he or is may become shocked. Okay? For the treatment, it's gonna be discussed by the other instructors. So sa rainy season, nag-i-increase yung transmission ng disease na ito. We've done measures in order to help us and prevent the transmission of dengue or this illness, especially kapag mga seasons na lagana po talaga ito. Okay? All regions of the country of the Philippines are endemic for dengue, and our children are at risk every day of the year. All right? So, next one. Okay? And we have to also assess for the other causes of fever. Okay? Sa mga bata na may malaria, dapat po meron po tayong parasites or antigens na makikita showing that there is a malaria infection sa blood na tinitest natin. Kapag yung bata may fever pero walang malaria, it's unlikely na yung bata may fever dahil sa malaria. So, pwede na ang ang cause ng fever ay ibang dahilan. Alright? There are 3 major categories of fever. May fever na may localizing signs. Ibig sabihin, for example, may fever plus pain upon urination. That's referring to UTI or urinary tract infection. Meron po tayong fever with a rash. Fever with a generalized rash, that's for measles. Okay? Meron po tayong fever with non-localizing signs as well. So, pwedeng unknown cause of fever ang ilalagay dyan. Okay? Kaya ang lawak po ng sakop ng fever kapag nag-assess tayo. Alright? So, pwede rin na ang cause ng fever ay may pneumonia, infection, dysentery, meningitis, ear infection, sore throat, or local bacterial infection. Kasi di ba we know that fever is a reaction to an infection. Okay? So, which are localizing signs that explain the infection that is causing fever. Alright? So, a child might also have fever due to infection with no localizing signs. So, wala ka talagang makikita. Alright? No localizing signs to help you determine what is causing fever, like septicemia, typhoid fever, UTI, HIV, or miliary tuberculosis. Ito mga infections na ito, difficult to diagnose without laboratory tests, and children are suspected of having these conditions should be referred to a hospital or for assessment. All right? One of the common causes of fever with a rash is measles, ayan, and which can also be caused by another viral infection such as chickenpox or severe infections like meningococcal meningitis or DHF. Okay, that's why important that we ask for all the main symptoms when assessing for any sick child so that we can pick up the common and serious causes of fever. Alright? Importante din po that we make an attempt to distinguish cases of possible bacterial causes of fever na magre-require na antibiotic treatment from cases of non-complicated viral infection. Pwede na ang bacterial or fever na nagkakause ng bacteria, caused by bacteria, meron po siyang signs ng local tenderness, refusal to use a limb, hot tender swelling, red tender skin or boils, lower abdominal pain, or pain on passing urine in older children. Alright, next po. Okay, so this one, asking about or measure fever in all sick children, meron na po yan sa IMCI chart, actually. Okay, I'm gonna be using the chart as we go along para makarelate po tayo kung paano natin gamitin yung chart. Alright? So, ayan. So, pag-assess ng child na may fever, check natin kung may history siya ng fever, if the child feels hot or has a temperature of 37.5 degrees Celsius or above. So, yan po yung basis natin kung may fever yung bata, 37.5 degrees Celsius or above. Okay? May history din po ba ng fever yung bata within the last 3 days of illness? Alright? So, importante that the mother understands yung question na tinatanong natin. Kung hindi po sigurado yung nanay, we can feel if the child's body is hot. Okay? Either po sa armpit or sa katawan ng bata. Alright? So, kapag hindi pa na-record yung temperature ng bata, ayan, we may feel the stomach or the axilla. Okay? Kapag naman walang history, of course, ang ilalagay po natin sa recording form ay no. And we assess for the next symptom. Yung sinabi ko po kanina, na kapag sinabing no, mag-assess na po tayo ng ear problem. Huwag na tayong mag-assess po ng other signs or signs and symptoms related to fever. Kapag naman may fever, we assess for additional signs. Okay? If assess the child's fever even if the child does not have a temperature of 37.5 or above or does not feel hot now. But history of fever is enough to assess the child for fever. Diba? Kasi kanina, like for example, sa measles, meron po tayong symptoms na nag-appear after mag-occur yung fever. Sorry. Ayan. So, decide then, next to that is we decide if the area of the child has been into a malaria risk area. Alright? Ask natin kung saan nakatira yung bata, nagstay ba siya overnight sa malaria risk area, or nag-visit siya sa malaria risk area in the last 3 weeks. So, ayan. Ito po yun. Okay? So, encircle natin malaria risk in the recording form. Okay? So, kapag malaria risk yung area natin, pwede tayong nag-take ng blood smear and examine din natin yan sa facility natin. Pero, wag na tayo mag-malaria test if there are other causes of fever. Okay? Mamaya, makikita po natin kung paano mag-check kung kailangan ba ng malaria test or hindi na. Okay? Alright, next. So, this one, I'm showing you the table ng mga malaria risk areas. Okay? So, yan. Ito kaso, this was in 2013. But, makikita po natin, meron po tayong stable, kaso high pa rin ang risk, may medium risk, at low risk tayo. And, nandito po ang Kalinga, Mountain Province. Ayan. And then, sa unstable naman, ibig sabihin, meron at meron pa rin cases. Sa sporadic, ibig sabihin, mangilang-ilang areas. At um, dito po naman ang Benguet, which is malaria-free actually. Yan. Okay. There we go. Next. Okay, so sa ating clinical assessment, I'm gonna open the chart here. Okay, ayan. So, kapag na-decide na natin na malaria risk pinanggalingan ng bata or nakatira yung bata, we have to assess the child for how long has the child had fever. Is it more than 7 days? Has it been present every day? Meron din ba siyang history ng measles? Ayan. Okay. We also assess for the other causes of fever. We assess for stiff neck. Yan. Runny nose. Here, just follow my cursor. We have signs of suggesting measles. For example, may generalized rash siya. Plus at least one of these like cough, runny nose, or red eyes. Okay. Meron sa malaria parasites, we can do malaria test. Sabi ko nga kanina, mamaya ipapakita ko kung paano tayo mag-assess kung kailangan po ba ng malaria test o hindi na po. Now, kung yung bata may measles ngayon or has had measles in the past 3 months, we assess for signs of measles complications. For example, mouth ulcers, pus draining from the eye, clouding of the cornea. Ayan, 'di ba? So, nasabi ko kanina na um, we still have to assess the child for a history of fever or if they had it in the past 3 days or past 3 months kasi we have to know and check kung yung presenting symptoms ng bata is just a complication, for example, of the measles. Alright, so ayan, meron po tayong 3 parts ng IMCI chart. Let me just put that here. Yung top part ng box natin, ito yung broken line. That's how we assess a child for signs of malaria, measles, or meningitis, and other causes of fever. The second part naman po describes how to assess the child for measles. Yan. and the third part is how to assess for the signs of DHF. Ayan, dito po tayo. So if you're gonna have that in full screen, nandito po yung assessment ng malaria. Okay, ito to yung measles. And ito po yung sa DHF. Alright. Hello class, I'm gonna be continuing my discussion on assessing fever. We are now on assessing further signs and symptoms of the child. For us to check if the child is with malaria, measles, or DHF, or dengue hemorrhagic fever, right? So, regarding the fever, di ba, itanong natin kung gaano katagal may fever yung bata. Kapag lagpas po ng 7 days, itatanong din natin kung yung fever ba present siya sa bata every day. Every day po ba nag-fever yung bata? If it's more than 7 days. All right? The reason why we're asking this is because most fevers caused by viral illnesses go away within a few days. All right? So, self-limiting po ang viral. Okay? However, if it's present every day for more than 7 days, this may mean that the child has more severe diseases such as typhoid fever or urinary tract infection. Etong mga batang ito, we have to refer them for further assessment. Okay? Now, we're gonna be checking on stiff neck. if it's present sa bata. We have to look or feel for stiff neck. Okay, showing in the right side of our screen is assessing the child for stiff neck. Okay, because this may be a sign of meningitis, a cerebral malaria, or any other very severe febrile disease that needs urgent treatment with injectable antibiotics and referral to the hospital. Okay, so while you are talking to the mother during your assessment, tingnan po natin kung yung bata na i-move and bebend ba niya yung neck niya easily when looking around. 'Di ba? Ang mga bata, mapapansin natin na nagiging aware sila sa mga nangyayari sa paligid sila, ang likot ng mga yan. Pero tingnan mo kung siya ba na igagalaw niya ba yung neck niya o hindi. Alright? Kung hindi, ibig sabihin may stiff neck na yung bata. Makikita po natin mamaya sa video na ipapakita ko kung paano ang stiff neck sa isang bata. Kapag hindi po natin nakita na gumagalaw yung bata, or if we are not sure, draw the child's attention to his or her umbilicus or toes. For example, pwede tayo mag-shine ng flashlight on the toes or umbilicus or tickle the toes to encourage the child to look down. Now, titingnan natin kung yung bata ba maiyuyuko niya ba yung neck niya, yung ulo niya, kapag tinitingnan niya yung toes or umbilicus niya. Okay? Kapag naman hindi pa rin niya maiyuko yung neck niya, hindi pa rin natin sure kung meron bang stiff neck or wala, pwede po rin po nating tanungin yung nanay, ask the mother to help you lay the child on his or her back. Lean over the child and support the child's back and shoulders with one hand, and with one hand hold the child's head. Then carefully bend the head forwards towards the child's chest, like what we're doing here on the picture. If the neck bends easily, the child does not have stiff neck. Kapag naman it feels stiff and there is resistance to bending, meron pong stiff neck yung bata. Okay? And one sign showing na may stiff neck yung bata is when the child cries when you try to bend the neck. Okay? That's how we assess for stiff neck. For runny nose naman, a child with fever may mean that the child has a common cold. Alright? So, kailangan po nating tanungin yung nanay kung may runny nose siya only with the illness na ina-assess mo at that time. Okay? Kapag malaria risk naman at may fever yung bata with the runny nose, hindi na natin kailangan i-test for malaria. Pwede din kasi na common cold lang yon or pneumonia or ear infection. Okay? Kasi sa malaria, runny nose is not a common symptom, is not a sign or symptom actually. Alright? So, sa measles naman, importante that we ask if the child has had measles within the last 3 months, okay? Kasi measles damages the child's immune system and leaves the child at risk for other infections for many weeks. Kaya po tayo nagkakaroon ng complications, okay? Such as eye infection. Alright? Now, we assess for signs suggesting measles too kapag yung bata dumating na may fever. Okay? So, titingnan po natin kapag may generalized rash yung bata with at least one of the following signs, which is with cough, runny nose, or red eyes. Alam po natin ang measles, may red eyes. Okay? That's a distinguishing symptom or sign sa bata. Alright? Yung rash, generalized. It starts from the ears and on the neck, sa ears, tsaka sa neck, usually dito sa likod, and then it spreads to the face. During the next day, dun nag-spread yung rash to the rest of the body, arms and legs. Alright? And after 4 to 5 days, the rash starts to fade and the skin may peel. Alright? And some children with severe infection may have more rash spread over more of the body, and it becomes discolored. It becomes dark brown or blackish. There is more peeling of the skin, Okay? Ang pinagkaiba ng rash ng measles sa iba, it does not have vesicles like blisters or pustules. Alright? Big sabihin, flat lang yan. The rash does not itch as well. So, makita mo lang talaga siya sa bata, flat, walang pustule, walang blisters or anything. Which is very different from chickenpox, Okay? Na makikita mo visible yung ano yung vesicles niya or scabies or heat rash. Alright? So, chickenpox kasi may vesicles yan at generalized rash yan. Ang scabies naman, usually sa hands, sa feet, sa ankles, elbows, buttocks, and underarms lang yan. And ito Makate. Alright? Heat rash naman, mayroon siyang small bumps and vesicles with itch. Alright? But although ang bata na may heat rash is not sick, may rash lang talaga siya. Reaction lang siya sa init. Pero titignan natin, ang measles, generalized rash, wala siyang vesicles, and hindi siya Makate. Alright? So, for other suggesting signs ng measles, pwede ang cough, runny nose, or red eyes. Alright? So, again, to classify, ayun nga, may redness siya sa sclera niya. Okay? That's suggesting of measles. Alright? Now, we are to look as well for any other causes of fever. Pwede kasing infection yon, local infection na nararamdaman ng bata kaya may fever. Alright? But remember that an obvious cause of fever also includes a cough or difficulty breathing, which is the main symptom which would have already been assessed, um, classified as dysentery or any ear problem. Alright? Kaya the next symptom, main symptom will be assessed, which is ear problem. Also, look for signs of infection or local, like local tenderness, hot tender swelling, boils, and if the child is older, difficulty in passing the urine or abdominal pain, or pwede kasing appendicitis. Ganyan. Okay? Ayan. So, again, malaria test tayo. Nasabi ko po kanina na I'm gonna be discussing kung kailangan pa ba nating i-test yung blood for malaria or not. Okay? Ngayon, do a malaria test if it is not possible to clinically distinguish fever caused by malaria from other causes of fever. Okay? Kasi nga marami po tayong cause ng fever. To be sure that a child with a fever or history of fever has malaria infection, kailangan natin ng malaria test. Okay? And this one also distinguishes falciparum from the vivax. But falciparum, again, is the most dangerous. There are two ways of actually examining the malaria. Ito pasadahan lang po natin. Although I'm not going to be showing you how this is done on the videos and pictures or later on, but we are using two types of test, using a microscope and checking for the blood using an RDT or rapid diagnostic test for the malaria antigens. Okay? So, kailan po tayo gagawa ng malaria diagnostic test? Okay? So, ito will only depend, okay, on the malaria risk in the area. Okay? So, kapag yung area is malaria risk and the chance of the child's fever is due to the malaria, posible na malaria lang naman ang dahilan kung bakit po may fever yung bata kapag galing yung bata sa malaria risk area. Okay? The test is done in all children with a fever or history of fever with no general danger signs or stiff neck. Hindi po tayo magte-test kapag yung bata may danger sign or stiff neck to avoid delay in referral. But instead, it will help us to give the pre-referral antimalarial and antibiotic treatment and refer the child urgently. Bakit hindi po natin kailangan ng i-test yung bata? Kasi may stiff neck na siya. This means that may complication na yung bata. Okay, may severe complication na or severe disease na yung bata. Okay? Iti-test mo lang siya kapag may fever na siya pero wala siyang danger sign or stiff neck. Klaro po? Okay. In a malaria risk area, a malaria test should be done in a child with no danger signs or stiff neck and no apparent cause of fever. No apparent, walang clear sign ng fever. Okay? Magte-test tayo kapag yung bata galing sa malaria risk area pero wala kang makitang danger sign or stiff neck at wala kang makitang clear cause of fever. Okay? Ngayon, sa mga area naman na hindi malaria risk, wala namang history ng travel sa malaria risk area, there is no chance of a child's fever being due to malaria. Kaya hindi na po natin kailangan ng test. Okay? So, once nag-decide ka na magte-test ka, blood smear through a microscope is done or RDT is done pag available sa clinic. Okay? Pero kung wala, pwede naman na itong gawin, i-refer agad sa kinauukulan. Alright? So, ang pagre-record nito sa ating recording form or having a positive or negative. Positive pag may nakita kang parasites. Yeah, note din natin kung falciparum or vivax ba siya. And you may have to add a full 14-day course of Primakin depending on the national treatment guidelines which will be discussed on the treat section. Okay? In areas naman or in situations where you are unable to do a test for malaria, i-classify lang nating malaria siya kapag yung children may fever, kapag galing siya sa malaria risk area at walang cause ng fever. Ito po yun. Okay? Alright, so next one. Ayan. So, for other signs and symptoms na kailangan nating i-consider, especially kung yung bata dumating na walang fever, i-check natin ang history ng fever, right? And of course, we have to look for the measles complications as well. Kaya, kapag yung bata may measles ngayon or within the last 3 months, we have to look for any complications in the eye or the mouth. Okay? It also, complication din kasi ng measles is having a stridor sa kalmadong bata, pneumonia, diarrhea. Although diarrhea, malnutrition, and ear infection are assessed later on. Pero importante po na tinitingnan natin kung yung bata ay may pneumonia o stridor. Alright? Look for mouth ulcers as well. Kailangan tingnan natin yung loob ng bibig ng bata. Okay? These are the painful open sores. Open sores. Take note, open sores inside the mouth, the lips, or the tongue. It may be red or have a white coating on them. And in severe cases, these are very deep and extensive. Okay? At kapag itong mouth ulcers ay nasa bata, may hirap na naman po yung bata na uminom or kumain. Naapektuhan na naman po yung nutrition natin, yung breastfeeding ng bata. Okay? Now, mouth ulcers are different from small spots called Koplik spots, kaya it's very important na we really differentiate this from the measles or from the ulcers caused by measles. So we have to look inside the cheek, okay? During the early stages of the measles infection. Ang Koplik naman, pinagkaiba niya po dito sa mouth ulcers ng measles. These are small, irregular, bright red spots with a white spot in the center. Okay, ito naman, nakakakain pa rin naman, nakakainom yung bata o yung baby. And they do not really need treatment. Alright? Another complication ng measles is the clouding of the cornea. Usually, dapat bright clear ang sclera natin. Okay? Or, not sclera, the cornea itself is usually bright and clear. Okay? So, kapag nagka-clouding, yung cornea natin, this is a complication. Okay? It should look like a glass of water when the cornea may look the way a glass of water looks when you add a small amount of milk. Ganun po yung itsura nitong complication na ito. Okay? Pwede din siyang mag-occur sa isa o both na eyes. Okay? So this is very dangerous because it can lead to blindness. Okay? At ito, kailangan ng urgent treatment with vitamin A because this one may be the result of a vitamin A deficiency as well, which has been made worse by the measles. Alright? The child with corneal clouding may keep his eye or her eyes tightly shut when exposed to light irritado. Okay, it may cause pain to the child's eyes as well. All right. So, to check for the child's eye, you have to wait for the child to open his or her eye. Okay, or gently pull down the lower eyelid for to look for clouding. Gamit po natin yung thumb natin. Okay? So if there is clouding of the cornea, ask the mother how long the clouding has been present. If the mother is certain that the clouding has been there for some time, ask if the clouding has already been assessed and treated at the hospital. If it has, you don't need to refer this child again for corneal clouding kasi pag-iwasan din natin ang paulit-ulit na gawain dito. Okay? Another complication is having a pus draining from the eye. Okay, isa itong sign ng conjunctivitis. It's infection of the conjunctiva inside the surface of the eyelid or the white part and also including the white part of the eye. Okay? Um, so, yung pus, it often forms a crust when the child is sleeping and seals the eye shut. So the eye can be opened or gently opened with clean hands, and we have to make sure that we wash our hands after examining the child for any pus draining from the eye so that we prevent cross-contamination or spreading of the disease or infection. Alright? So, nandito na po tayo sa classification ng bata according to the IMCI chart. Okay? Um, I'm gonna open the chart here. I'm gonna be using this one so that it's easier for us or it's easier for you to go along or follow along with me. Okay? But I'm gonna also be showing you the explanation so that it would be clear as well. So there, the classification of the fever. Okay? Pwede natin siya i-classify as very severe febrile disease, malaria lang as yellow, or having no fever. Okay? So, ang bata na may, sandali lang po, ayusin lang po natin. Ang bata po na may fever at may karagdagang general danger sign or stiff neck, that is a very severe febrile disease. Okay? That's a very severe febrile disease. Consider natin na kapag nag-a-assess po tayo ng history, okay, yan, malaria risk ba yung area? Does the child live in a malaria area? Nag-travel ba yung bata? For how long has he had measles? Okay, check natin for stiff neck, runny nose, bacterial causes, kasi baka hindi naman malaria, especially kung hindi galing sa malaria risk area yung bata. Look for signs of measles. Okay, nandito po ta, section na ito lahat. Ito yung initial assessment natin, including the temperature sa lower left side natin. Okay? So, sa malaria risk area, alright, again, hindi natin ititest po ang malaria kapag meron na siyang stiff neck or general danger sign. Okay, very severe febrile disease na yan. Alright, urgent referral na yan. Okay, ititreat na po natin to as malaria. Okay, for severe malaria. Right? Kapag naman positive, 'di ba, ite-test natin ang for malaria kapag wala tayong makitang danger sign, pero may fever. Okay? Yan. So, hold on. Where is it? Okay, tama. Ayan. So yes, tapos pa tayo sa pag-classify ng very severe febrile disease and the classification of malaria only on the yellow section. Okay? So, yan, sa malaria risk area, a child with fever or history of fever na walang danger sign ay positive sa malaria test, malaria lang po ang ilalagay natin. Okay? Kapag naman po yung test ay hindi available pero may fever siya or history ng fever, pero walang danger sign at walang cause or clear cause or show sign ng fever, malaria din po natin ang ilalagay natin. Okay? So, pero kapag galing siya sa low malaria risk area or non-malaria risk area, posibleng hindi ito malaria. So, kaya we have to assess for other symptoms. Okay? Treatment, i-discuss po yan ng isa sa mga kasama ko sa inyo later on. Okay? So, let me pull up the chart. Yan. Sa pag-test po natin naman ay negative, ibig sabihin may ibang cause ng fever. Fever lang po ilalagay natin with no malaria. Okay? Yan. Let me just pull this one up. Okay. Now we're gonna be classifying the fever. Alright, so sorry about that. I think this is where this green one, I've discussed that here, fever, having no malaria kapag negative at wala namang nag-indicate na malaria yung cause ng fever ng bata. Okay? Sa measles naman tayo, mm, lahat po ng bata with fever and measles now, ibig sabihin, pagdating niya po sa clinic or health facility, may measles siya, with showing generalized rash, cough, runny nose, or red eyes, or within the last 3 months, kailangan po natin i-classify for measles complications. Okay? For severe complicated measles is if the child has measles or with measles have general danger signs, clouding of the cornea, deep or extensive mouth ulcers. These are severe complicated measles. Okay? So sa chart po natin, makikita natin na ayan, kapag may danger sign, or clouding over the cornea, ulcers, these are severe complicated measles. Okay? So this is, proceed lang po tayo dito sa part na to kapag na-assess natin na may measles yung bata ngayon, pagdating sa'yo, okay, or within the last 3 months. Okay? Yellow naman po tayo. Let me just fix the chart here. Yan. Yellow po tayo kapag yung bata may pus draining from the eye, which is a sign of conjunctivitis, or mouth ulcers na deep and extensive. Okay? The child has having measles with eye or mouth complications only. Yun po yung classification niya sa chart natin. Okay? Ayan. Ayan po yung classification natin. Para naman po sa green one, kapag may measles siya ngayon or within the last 3 months at wala naman pong nakalagay or nakikita na complications sa bata, ilalagay po natin is measles lang. Alright, ayan. Sa pag-classify naman po ng DHF, we should assess for the DHF for all children 2 months of age or older with fever in areas where there is a risk of dengue hemorrhagic fever, because these children should be assessed for other causes of fever. Okay? Sabi ko nga, 'di ba, it's either malaria, DHF, or measles, or other illnesses ang nagko-cause ng fever. So for assessing or in assessing for the hemorrhagic fever, this is where you put those or where the questions are asked. Okay? May bleeding ba yan? Sa gums, vomitus, may melena ba yan? Okay? Yan. May abdominal pain ba? Persistent vomiting? Okay? We have to look and feel for signs of bleeding and shock as well. May petechiae ba? Cold and clammy extremities, signs of shock. Check for a slow capillary refill. Ayan. Okay. Um, by the way, there is what we call tourniquet test. Um, I'm gonna be discussing that later on, alright? But this is one of the assessment that we do kapag hindi po natin makita ang signs ng DHF sa bata. Alright? But for now, I'm gonna be showing you how to um, look into the chart in order for us to classify yung DHF sa bata. Here you go. Ayan. So kapag meron po tayong bleeding, lahat ng signs ng bleeding, okay? Petechiae or signs ng shock, capillary refill more than 3 seconds, cold and clammy extremities, severe dengue, hemorrhagic fever po yan. Okay? Pero wala po tayong signs ng severe DHF, fever lang po yan, DHF unlikely. Okay? Ayan. So, na-establish po natin na ang temperature natin dito is auxiliary. Alright? So, for further information, bleeding manifestations natin, sa bleeding sa nose and gums, there may be dried blood in the nostrils. Kung kailangan din nating silipin ito. Alright? Petechiae on the skin are small hemorrhages in the skin. They look like small dark red spots or patches on the skin. These are not raised and not tender, but if you stretch the skin, they do not lose their color. They may also be easily seen on the abdomen or chest or extremities sa bata. Shock naman kapag yung circulation ng bata ay pumalya. Okay, this one needs urgent referral. Meron pwede pong abnormally pale, restless, sleepy, difficult to awaken, cold, clammy extremities, low capillary refill na meron din po sa chart na pinakita ko kanina. Okay? So, for assessing for cold, clammy extremities, hawakan po natin yung kamay ng bata. Okay? If a child's hands feel warm, the child has no circulation problem. And we do not really need to assess for the refill of the capillary. Pero kapag cold and clammy siya, pwedeng may shock na yung bata, in shock na yung bata. Kaya kailangan natin i-assess yung capillary refill. Okay? In checking for the capillary refill, we have to hold the child's hand or foot and look at the pink nail bed of the thumb or big toe. For 2 seconds, apply the pressure, minimum pressure needed to make the nail bed lose its pink color, and we'll release it and we watch how it goes back. Okay, if it takes less than 3 seconds, the circulation is still okay, it's adequate. But if it takes longer than 3 seconds, pwede kasi itong sign ng shock na. Okay, so, yan, dito po tayo sa tourniquet test. Okay, so, kapag yung bata hindi naman in shock or walang signs ng bleeding, petechiae, or any abnormal abdominal pain, vomiting, or is 6 months and older pero yung fever present siya for more than 3 days, basically wala po kayong makita talaga na signs or anything. Alright, pero yung fever present ng 3 days, kailangan na po natin mag-tourniquet test. Okay? So, what we do is to take the systolic blood pressure. Take note, this is just for the 6 months and older. Okay? Systolic BP, alright, and the diastolic BP using a pediatric cough. We inflate the cuff to a pressure halfway between the systolic and diastolic pressure, and we keep the pressure for 5 minutes. We release the pressure and draw 1-inch sized square below the cuff on the front surface of the forearm. That's 1 inch. 1 inch is about the size of the last joint of the index or the point finger. And then there you go, basically it. Count the number of petechiae inside the square. So if there are more than 20 or equal to 20, the test is positive for DHF. Okay? Okay, there you go. This is how we classify for the DHF na pinakita ko po sa chart kanina. We pull it up again. Ayan. Okay. So, natapos po tayo mag-assess sa malaria, measles, at saka DHF. Take note na yung may asterisks po tayo, yung mga ganyan. meron po tayong corresponding information sa baba. Okay? So that we are guided on what we will do as well. Especially when we base it sa ating IMCI chart. Okay? For example, dito, look for any bacterial cause of fever, dalawang asterisks. We're gonna look for local tenderness, oral sores, boils, or any related symptoms na nasa bata. Okay? Ayan. So this is the recording form. If you've noticed, we've been using the kid Fatima up until now while we are doing our assessments. So yung una po natin for danger signs, lethargic or unconscious. And then difficulty of breathing, meron po siyang fast breathing, so severe pneumonia. Diarrhea, na-assess po natin na may severe dehydration yung bata. And if may fever, very severe febrile disease, okay? Yung measles natin, nandito din sa form, ear problem, which will be tackled by the other instructors, okay? Ayan, so na-classify natin siya na very severe febrile disease. Low malaria risk naman siya, nag-fever siya ng 2 days, kaso may runny nose, okay? And meron siyang danger sign, kaya very severe febrile disease, okay? So these are for further readings only. Now we are to look into assessing the child for stiff neck.
Next, look or feel for stiff neck.
Sorry about that. I'm going to show you how we ask the mother about the fever first, so that we do this step by step.
Assess every child for fever whose mother gives a history of fever during this illness, or who feels hot, or who has a temperature of 37.5 or higher. Ask,
does the child have fever?
It is important to make sure that the mother understands what fever is. Use a local term for fever, or ask the mother whether the child's body has felt hot to her. A child may not be suffering from fever at the time when it is brought before you. However, it is important to know if the child has had fever with this illness.
Fever is assessed because fever in a sick child can be a sign of serious illness, such as malaria or measles. If you do not have a thermometer, feel for fever. Feel the child's stomach or under the child's arm and determine if it feels hot.
Assessing a child for signs related to fever is a two-step process. The child is first assessed for signs of malaria and for measles, and then, if measles is present, for signs indicating complications of measles. First decide the malaria risk. Is there a high or low risk of malaria? Then ask,
for how long?
If the fever has been present for more than 7 days, ask,
has fever been present every day?
Ask,
has the child had measles in the last 3 months?
Alright, I'm going to show you the next video. This one is how we assess for stiff neck.
Next, look or feel for stiff neck.
It's important to assess a child with fever for stiff neck because the child may have meningitis.
First, watch to see if the child bends his neck while looking around. If he does this spontaneously, he does not have a stiff neck. Paying his attention to neck muscles.
If the child can look down, almost touching his chin to his chest, there is no stiff neck. If you are not successful in getting the child to bend its neck, you should slowly, gently, put your hand behind the child's head and try to bend the neck. The neck should move easily.
Mhm. Alright, so this one is showing you a kid
Next,
with a runny
look for
nose.
Low malaria risk setting, nose in a child with a fever may indicate a cold. In a low malaria risk setting, observing whether a child has a runny nose helps to distinguish whether the fever is due to malaria or a cold.
This one shows you a video of a child having measles,
Look
generalized
to
rash.
see if there are signs suggesting measles. Look for a generalized rash.
In measles, a red rash begins behind the ears and on the neck. It then becomes generalized. That is, the rash spreads to the face and body. Then the arms and legs. A generalized rash like measles covers the whole body. It should not be confused with a rash like scabies, which is usually found on the arms and stomach. Nor does measles appear just as a rash only on the face or on the scalp.
A child with measles will also have one or more of these three signs: a cough, a runny nose, or red eyes. If the child has measles, move on to the second part of the fever assessment. When a child has the signs of measles, it is important to continue assessing the child for signs of eye or mouth complications. Look for mouth ulcers. Are they deep and extensive? Look inside the mouth for mouth ulcers. This child doesn't have mouth ulcers.
But this child does. These are painful open sores on the inside of the mouth, lips and tongue. They may be red or have a white coating on them. Mouth ulcers make it difficult for the child to drink or eat.
Next, look for pus draining from the eye.
This child has pus. Measles can be complicated by an infection of the conjunctiva, or white part of the eye. This can be identified by the pus which collects in the eye.
Look for pus on the conjunctiva, or eyelids, or draining from the eye. Next, look carefully for clouding of the cornea.
The normal cornea is bright and transparent. Through it, The iris and the round pupil at its middle can be seen. A normal cornea allows you to see the colour of the iris clearly. The pupil is black. Measles can cause a white spot or clouding to appear in this part of the eye. The clouding may occur in only one or both eyes. When exposed to light, the condition may cause irritation and pain, and the child keeps the eyes tightly shut. Corneal clouding can progress to bad ulceration of the cornea, like this, which can result in blindness.
That completes the assessment process for fever.
Here guys, I'm just gonna show you how to assess for stiff neck. So here in this video, you're gonna see how clear and visible the stiff neck is. Let me just play that for you.
What did you decide?
Alright guys, so thank you so much for being with me sa discussion ko. That ends my part in here, so good luck. Thank you so much.